Welcome back. They are your exclusive local experts in orthopedics and sports medicine and rheumatology.
Today we're talking about a term that you've likely heard, Ambulatory Surgery Center.
OSMS has 2 such centers that offer a lot of benefits to patients when it comes to safety and cost.
Good morning, Channel 5. I'm Lauren from OSMS, and today I'm joined with Amanda Cisniewski. She is our Orthopedic Surgery Center Administrator. Amanda, thank you for joining us today.
You bet.
Yeah, so OSMS has 2 orthopedic surgery centers, and sometimes people may hear us call them an ASC or an ambulatory surgery center. Can you describe what that is and how it compares or differs from a hospital?
You bet. Ambulatory Surgery Centers, or ASCs as we refer to them, are modern healthcare facilities, but they're unique and different than a hospital because most are niche or specialty, like OSMS's surgery centers. We provide orthopedic, spine, and pain procedures, and ASCs around the country have been popping up since about the 1980s, and there's about 6,000 in the United States. So we're able to offer the same high quality procedures done in a hospital setting without the overhead costs of a hospital to keep an expensive ER or maybe cancer center open at a much lower cost to our patients, but maintaining that high quality and great patient experience.
Now, safety is our top priority when it comes to surgeries. So can you describe some of the operations that we go through in order to keep our patients safe?
Yes. At both of our ambulatory surgery centers in both Green Bay and Neenah, the OSMS Surgery Centers feel very strongly about being regulatory accredited, I should say, by an organization known as AAHC, which is the Accrediting Association of Ambulatory Surgery Centers. And we also choose to perform procedures that are Medicare or Medicaid procedures, which means we have to go through a rigorous process with both the accrediting body and CMS to make sure that we uphold the same standards that any hospital would have to uphold. It's a choice to do that, and by doing that, we have to adhere to very strict policies, and we take pride in every single step of the process. What's really important is, and probably most important to our patients, is infection prevention. And when it comes to sterilization, decontamination, that is probably the most scrutinized area of the regulatory visits by AAHC and CMS. And we always pass with flying colors because we have an amazing team that supports and makes sure that all quality assurance is maintained so that patients are properly cared for.
And when it comes to infection rate, postoperative infection rate specifically, can you describe why it's important that it's so low and how our infection rate compares to other places?
Yes. In both of our ASCs, we're doing about 1/3 of our volume of total joint procedures, which are very high-risk procedures, and our infection rate is less than 0.25% of what the average ASC infection rate is. So that's really, again, a tribute to our team. We really start with patient education prior to surgery, making sure that the patient is making healthy life choices, meal planning, prepping their home, things like that before surgery, which all compound to their healing and really their road to speedy recovery.
I know that you mentioned a few times before too about cost. How does us having our own independent surgery center affect the cost for our patients, and how can we control those costs compared to other places?
So why ambulatory surgery centers tend to be lower costs is, like I said earlier, we don't have expensive ERs or other ancillary services to provide, but we still do that same amazing procedure that can be done in a hospital here in our surgery center. We pride ourselves at OSMS to be able to offer cash solutions for those who choose not to be insured, and people can go right out to our website and find out what their cash pay options are. So that is all out there. They can choose their doctor. It's honestly like going and doing some online shopping if you wanted to. So it's a whole bundle of care.
OSMS has surgery centers in Green Bay and Neenah. You can learn more by calling 920-430-8113, online, osmsgb.com.